Hello, and thank you so much for joining us today. My name is Catherine Dunlap, and today I will be discussing quality methods in healthcare. So today we'll be talking about the implementation of a quality improvement program here at Chaparral Regional Hospital, and we'll be talking about the pros and cons of implementing such a program. There will be a lot of information today, but I will be holding a Q&A session after the presentation so we can address anything that you felt wasn't covered properly and ask any questions that you may have. So with that, let's get started. What is a quality improvement program? So a quality improvement program in a hospital is a structured approach to continuously enhance the delivery of healthcare services. It involves identifying areas where improvements are needed, implementing evidence-based practices, and measuring outcomes to ensure high quality care. So to simplify that, we're just basically going to be looking at every single department in the hospital and just seeing where things could use improvement. This is not about, singling out any person or any department. It's just simply making sure that we are doing everything that we can to provide the best care possible. By analyzing data, identifying opportunities for improvement, implementing changes, and monitoring progress, a quality improvement program aims to drive a meaningful and sustainable enhancements in the quality and efficiency of healthcare services provided by the hospital. So what are the pros of a quality improvement program? To start out, patient-reported outcomes, also known as PROMs, provide valuable insights into patients' perspectives and experiences, offer a direct assessment of the impact of healthcare interventions on patients' quality of life, and enhance patient-centered care by considering the outcomes that matters most to individuals. Process measures enable evaluation of adherence to established guidelines and best practices, help identify gaps in care and opportunities for improvement, can act as an early warning system for potential issues or variations in care delivery. Access the effectiveness or clinical outcome measures. So it allows us to access the effectiveness of interventions and treatments, provide evidence-based data on patient outcomes and indicators of quality, of healthcare quality, and aid in benchmarking and comparison between healthcare providers. So just like with anything, any program implementation or anything new, there are pros and there are cons, and this will be no exception. So a con, to start off with, a potential con could be the limitation of patient-reported outcomes. Interpretation of self-reported data can be subjective and influenced by various factors, require standardized and validated instruments to ensure reliability and accuracy, may not caption certain clinical or objective outcomes, limiting a holistic understanding of healthcare effectiveness. Another con would be challenges with process measures. Process measures may not always align with patient-centered outcomes or personalized care. Overemphasis on adherence to processes may lead to a checklist approach, potentially overlooking the unique needs of individual patients. Quality improvement based solely on process measures may not always translate to improved patient outcomes. Considerations for clinical measures. Some clinical outcomes may take a longer time frame to assess accurately, making real-time evaluation challenging. Clinical outcomes can be influenced by various factors beyond healthcare providers' control, such as patient behaviors or socioeconomic conditions. It is crucial to ensure risk adjustment methods are in place to account for differences in patient populations among healthcare providers. So, in conclusion, quality improvement programs play a crucial role in enhancing the healthcare of delivery services. the pros and cons of such programs are significant, but they offer a systemic approach to identify areas of improvement, implement evidence-based practices, and measure outcomes effectively. I just want to kind of expand on that a little. I do believe that, although there are pros and cons to, or, more so cons in implementing a quality improvement care program, I do not believe that they are insurmountable. I do not believe that they are things that we cannot overcome. There are growing pains to anything, right? Nothing, when you're implementing a system, especially a system that is meant for change, positive change, it won't be easy ever. So yes, there will be challenges, but I believe that they can be overcome. And I believe that implementing a quality improvement program will be one of the best things we have ever done, because we all have a common goal, is to deliver the best possible health care to patients and to improve their quality of life. So I do believe that a quality improvement program would be in the best interest of this hospital. As promised, we will have a Q&A session after. For those of you who would like to participate in that, I invite you to stay on. Otherwise, you have a wonderful day, and please reach out to me if you have any questions or concerns. And I thank you all for your time.